Scar tissue. Chances are you've heard of it, and chances are you probably have some. I'm cancer physical therapy specialist, Dr. Leslie Waltke. Today in the recovery room, we're talking about scar tissue and why it may be common in people who've been treated for cancer. In this video, I will be showing you some pictures of scar tissue, both on the outside of the body and on the inside of the body. It's nothing bloody or gory, but I will give you a heads up before each, just in case you are a bit squeamish. Scar tissue is the body's natural response to trauma or damage to the soft tissues. It can generally happen in two different places. Number one, it can form on our skin, like when we're cut or have a surgical incision. And number two, it can form on the inside of the body, again from something like surgery, radiation, or disease. Let's first talk about external scars. A good percentage of people who have cancer will end up having surgery. Whether it is a minimally invasive surgery or an open surgery, the body will be cut in one or more areas to allow the surgeon to get inside. When the surgeon is done, they will pull the two edges together and then hold those two edges together with something like staples, glue, or sutures. The magnificent body will then heal the incision over the next weeks with a scar, and the area will be permanently closed. Here are a couple examples of external scar formation after an incision. I am now going to show you a picture of a surgical scar on a woman's back. This scar is about 2 to 3 weeks old. Now I'm going to show you a mastectomy scar on a gentleman. Okay. This scar is about 14 weeks old. So now let's look at internal scar tissue. To show you a before scar tissue scenario, I am now going to bring in a picture of a chest just after the breast tissue on that side has been removed. Okay, so you can see the underside of the skin here, and this is the chest wall muscle called the pectoralis major. And now let's look at this chest wall area again about a year after surgery and see what has happened. Okay, this, my friends, is scar tissue. Okay, surgical slides are done. Now, scar tissue is much less elastic than normal tissue. It doesn't stretch, it doesn't bend, move, or compress nearly as well as normal tissue. And this is what may lead to pain, tightness, and limited movement in that area. So here is the million-dollar question. What are you supposed to do about it? Scar tissue development is a normal physiological process that you can't control, I can't control, and your doctor can't control. It just happens. Many times people have scar tissue and they don't even know it. But if the scar tissue is in an area where it affects normal movement, the continual pulling and tugging on that scar tissue can lead to irritation, pain, and decreased mobility. The antidote to tight scar tissue is a good stretching program. Now, because scar tissue can take months or years to fully mature, you may need to stretch for months to years before you feel like the tightness finally goes away. But this is why stretching after surgery is so important, especially if surgery is combined with radiation. I will put some of the links for the recovery room videos on scarring and stretching in the description section of this video. If you are still having pain or tightness, even months or years after surgery or radiation, it is never too late to make it better. So talk with your cancer doctor or nurse about getting you to a physical therapist. Thank you for joining me. Knowledge is power. Knowledge leads to better decisions and better care, and that is an awesome thing. If you found this video helpful, please hit the like button and share with your people and groups. I'm Dr. Leslie Waltke signing out from the recovery room. Let's talk again soon.